Explosions can be heard throughout the fight, debris flies in all directions, legs and arms are shattered, men are injured. In the middle of the fight, a scream is heard, "Help me!" In this chaotic scenario, a question arises: how are the injured rescued? First, let's look at some definitions. Personal aid, first aid and aid to companions are emergency procedures carried out by anyone, whether or not they have been trained. Emergency medical procedures are, in principle, carried out by qualified personnel. Definitive medical treatment is specialized treatment for the injured or sick person, carried out by medically qualified personnel, generally a doctor. But what is the solution when healthcare personnel are away from the combat zone or when the combat mission is isolated or in the enemy's rear where there is no possibility of medical support? One solution is for one of the warfighters to be designated lifeguard, that is, to specialize a member of a non-medical unit selected by the unit commander for additional training beyond basic first aid procedures, referred to as enhanced first aid. This training is obtained by allowing lay combat military personnel to have contact with urgent and emergency procedures in health units for a few months under the guidance of a doctor. The placement of tourniquets, trauma care, containment of bleeding and other measures that must be initiated immediately before the arrival of the specialized health service carried out by a doctor. When a soldier is injured or has an illness, a problem arises. Should this patient be evacuated or treated on site? Generally, the tactical situation led to the nature of the illness or injury will influence your decision. What instruments and equipment are available? In a combat mission, the platoon, in principle, will only carry the instruments and equipment included in the first aid bag. What to do? Steps in solving medical problems. Always perform a quick physical examination on the patient and obtain a clinical history, albeit a brief one. Observe and note whether the injury was caused by a firearm, a trap, or a fall from a vehicle. If it is a puncture wound, check for more than 2 holes. Raise the number of injuries. Check for severe bleeding, internal bleeding, or a fracture. Quickly assess vital signs, pulse, blood pressure, breathing, to determine if the patient's life is threatened. Protect the patient in a safe position, according to their injuries. Clear the airways and perform artificial respiration, if necessary. Control bleeding as quickly as possible. Treat shock if necessary. The body needs a constant supply of oxygen. Brain cells can die within 4 to 6 minutes without oxygen. The inhalation and exhalation cycle must be maintained between 12 and 18 times per minute. All measures must be immediate in order to maintain breathing, avoid loss of blood volume, avoid shock, and prevent infections. Ask for medical help. Remove the patient to a place and request evacuation if necessary. A curiosity is battle fatigue. There were George Patton slapping incidents that occurred in early August 1943 when Lieutenant General George S. Patton hit 2 United States Army soldiers who were under his command during the Sicilian Campaign in World War II. Patton's hardline personality and his disbelief in the medical condition post-traumatic stress disorder, then known as combat fatigue or post-war trauma, caused soldiers to become targets of his ire in incidents in the August 3rd and 10th, when the general beat and berated the 2 men after discovering that they were both patients in evacuation hospitals far from the front lines without having suffered any apparent physical injuries. The United States Army until World War I regarded symptoms of battle fatigue as a type of cowardice or as attempts to avoid combat duty. Soldiers who reported these types of symptoms received harsh treatment. It is believed that the 2 soldiers Patton hit were at the time suffering from battle fatigue, also known as post-war trauma or battle stress. Currently, this condition is characterized as a form of post-traumatic stress disorder, which can be the result of prolonged exposure to death and destruction, among other traumatic events. Although the causes, symptoms, and effects of the condition were already familiar to doctors at the time of the incidents, it was less understood among military circles. These incidents show that it is not always easy to assess other people's pain. How do you know which injured person should be evacuated first? Precedence of evacuation categories. Judiciously assess the nature of the injury, or the severity of the illness, when establishing evacuation precedence. In principle, precedence is established as follows: urgency, priority, and routine. Urgency is reserved for those patients who must be evacuated within 2 hours, with the aim of saving their lives or limbs. It means that the patient will be evacuated immediately, with the maximum waiting time limited to 2 hours. Priority patients are those who must be evacuated within 4 hours. This category also includes patients whose conditions may worsen in the short term, normally within 4 hours, counting from the moment of trauma or the onset of the disease. Preferably, he will be evacuated as soon as possible, within the limitations of available and indicated resources. Routine treatment is reserved for patients whose conditions are not expected to worsen for some time, normally more than 4 hours. Patients who require a medical consultation, have a minor injury or illness, or require treatment beyond the capacity of the aid station will be evacuated after all emergency and priority patients have been evacuated. After administering the necessary treatment to the patient, and before being evacuated, write the evacuation medical form, identification, probable diagnosis, treatment carried out, reactions to treatment. So, here are some valuable tips. If a back or neck fracture is suspected, do not move the victim unless his or her life is in immediate danger, such as near a burning vehicle. Movement can cause permanent paralysis or death. In a chemically contaminated area, do not expose wounds. Leg fractures should be immobilized before elevating the legs as a first aid measure for shock. If a neck injury is suspected, immediately, manually, immobilize the head and neck. Place a roll of cloth under the victim's neck and place heavy boots, filled with dirt or sand, or rocks on either side of the head. The tongue is the most common cause of airway obstruction. In most cases, simply using the head tilt/chin lift technique can clear the airway. This action moves the tongue away from the air passage in the throat. The victim's tongue goes back into their throat while they are unconscious. The tongue falls back and obstructs the airway, preventing the victim from swallowing it. These are some procedures that must be thoroughly trained and carried out until specialized medical care arrives. But the mission does not end, as our prayers continue with the injured patients and our care is renewed with each cry for help.